Hi, I'm Dr. Michael Wong, a cardiologist, and I've been in practice for over 40 years. I was first trained to take care of heart attacks, but in the 1990s, three important things happened. Number one, there was a trial that showed that patients who have heart disease, by taking a statin, a cholesterol-lowering drug, was able to reduce recurrent events by 30%. Number two, the Heart Association began to have lipid centers around the country that were educating physicians, and I took one of their courses. The third thing that happened was that we were able to detect coronary disease without invading the body, that is, with a heart scan. And this allowed us to find out who had and who did not have coronary artery disease. As a result, I began to focus on preventing heart attacks and preventing second heart attacks. I want to tell you about a patient that I saw this week. He's a 44-year-old soccer player who thought he was bulletproof. But he was here because he wanted to be sure that everything was okay. So we did a coronary artery calcium score and it was quite high. So I explained to him that before the calcified plaque occurred, he had soft plaque. It's the soft plaque that ruptures. On the left-hand side is the normal artery, and as we progress on down this picture, we can see thickening and then soft plaque production right here. And he couldn't believe it because he could run for hours playing soccer. And I tried to dispel the myth that you can control your cholesterol by exercise. I finally showed him a picture of cholesterol crystals, which are very sharp and edged and can puncture the plaque and cause a heart attack. And I showed him also pictures that if you take the cholesterol medication, that you can blunt those sharp edges of the crystals. And finally convinced him to start taking the medication and stop eating his favorite foods, which was crab and lobster and beef and shrimp. But I told him he needed to stop it only for 6 months, and that we would revisit it at a later time to see what his response was to therapy. He and I talked about what's good to eat. We can eat great proteins from pork tenderloin, chicken, fish with fins, and egg white. You can have delicious vegetables high in antioxidants, including purple cauliflower or eggplant. And you can make a delicious sauce using non-fat evaporated milk. Remember, if it has a fin, it's in. The last point I want to make is that women are having more heart disease than men, and this has been true since the mid-1980s. They've been overlooked and neglected, and this has to be reversed. Everyone's risk factors are different. Please call for an appointment so I can answer your questions. Thanks for watching.